next time you could just do it as an open Zoom link, because you can have several hundred people watching at the same time, as opposed to trying to do it on YouTube as well. Yeah. Cool.
So welcome to part 2 of AOD Media Watch's webinar. We've had a little breach of, had a little issue with YouTube and live streaming of footage related to alcohol and other drugs. But the footage that we were streaming was quite sensational. It was people presenting at emergency departments, being treated for alcohol intoxication. It's what anybody who's worked in a hospital sees every Friday, Saturday night. And the footage is quite confronting. It's quite sensational. So as I'm not a journalist, but to me, that seems to make a good news story. Kate, why isn't this a good news story?
I'm really glad it's not a good news story, because it would be a kind of horrific sort of journalism, incredibly voyeuristic, incredibly insensitive, to be contacting, to be chasing people to tell a story when they're incapacitated, when they should be being as honest and open as they can to the medical staff around them, when there may be legal issues going on that are yet to be revealed. Like, they may be victims, they may be perpetrators of various crimes that are going on because there's been some impairment and some issues, some drama, some injury. So I don't think that that is a good place for a journalist to be, because we don't want journalism to be interfering with the justice process. We certainly don't want journalism to be interfering with a medical process. And I think as a journalist, how much story could you get out of that anyway? Oh, here's a person, they're being sick. That, you don't necessarily want to be saying any more than that. And I just don't think there's all that much story to be told there. And where there is crime, those stories come out later in due course through the court cases, as they should. But I would be a little bit horrified to see that becoming like grist for the journalistic mill. But what do you think, Flip?
Sometimes I think, showing it can have shock value, I think sometimes it's really hard in those circumstances. Often people don't see that sort of behaviour, or if they're in that condition themselves, they don't actually see the kind of impact that has because they're unconscious. And I think it sort of demonstrates the burden that this kind of thing actually places on the health system. I think it's important stories to tell, to be honest. It's uncomfortable viewing, and I don't think we should shy away from that, because I think one of the things that I found about being really drunk and being really incapacitated is that we're very quick to move on and downplay those sorts of behaviours. And if you've had a really big night out and you've ended up sort of throwing up and you've been hungover in bed all day, or you tripped over and you hurt your knee or something, people tend to laugh it off. And I think actually sort of showing that in full technicolor and saying, actually, this is not just kind of something that you did to yourself, but it's something that is actually quite a big burden on society, is really important. And I think there's sensitive ways to do it.
So in many respects, I understand what Kate's saying. There are issues in terms of, you don't want journalists going onto the floor of emergency departments. At the same time, though, as you're saying, Flip, if we're not telling those stories, people are able to shy away from the harms, and it kind of minimises potentially the public's perception of the harms associated with alcohol. And so, Monica, as someone who conducts research into the harms associated with not only alcohol but other drugs as well, what impact do you think this lack of public awareness about what sort of goes on a Friday, Saturday night in an emergency department has on alcohol-related harm, but also the use of other drugs?
Yeah, thanks, Steve. It's been interesting hearing people think, and Flip was mentioning this idea of the lack of awareness. I'm not sure if there's a full lack of awareness out there that these things happen, but I think, as Professor Kunch pointed out in the documentary, the issue is that the negative repercussions aren't as immediate as the positive repercussions. When, I liked his analogy. He said, if every time you had a drink you got hit on the hand with a hammer immediately, then you'd probably stop doing it, right? So, for some of us, we just like the positive effects too much to actually stop despite the delayed negatives, even if those negatives are really bad negatives, like some of the stuff that we saw in the hospital, or even in terms of the liver transplant patients that we saw in the first episode, where their chronic alcohol use over many decades caused, it has basically nearly killed them. But there is still this pull to back to drinking. So I think we've also mentioned earlier this idea of cognitive dissonance, and this idea that you think of this problem as something that happens to other people. And I think that attitude is something that we all share, and it was something that was put out on a number of occasions throughout this documentary, this idea that alcohol is fine in moderation, and it's only some at-risk people who should avoid it. And I think it's particularly useful, this idea, for alcohol marketing and the alcohol industry, is this idea of, drink responsibly. This pushes it back on the individual. So yeah, that was interesting that came out. I think as to the question of how these alcohol news stories relate to our reporting of illegal drugs, yeah, there's a massive contrast. And I think Steve mentioned earlier that AOD Media Watch, even though there is an A in the AOD Media Watch, which is A for alcohol, we've very rarely done stories, if any stories, on alcohol until now. And, I think that's part of this issue. And it really struck me. I mean, I knew these statistics, but I hadn't thought about it for a while in the context of COVID that we're all living in now. That, it was mentioned that 6,000 deaths per annum in Australia can be attributed to alcohol. And yet, we are moving, we're basically stopping our entire economy to stop the spread of COVID-19. Because we're anticipating that there could potentially be thousands of deaths if we didn't do that. And I imagine there would be thousands of deaths if we hadn't taken those actions. But here we are with some actions we could take to reduce the availability of alcohol, to change the culture around alcohol, which could also save thousands of deaths, but we're not prepared to look at that. Because I think, and then the other thing we do is we'll scapegoat other drugs. So we're making these stories, sensational stories, methamphetamine, heroin, MDMA, cannabis, but we're not as prepared to look at the one that's actually causing the most harm.
So just on scapegoating, Monica, the media often perpetuates this narrative of scapegoating young people. It's young people that are the problem. But the data shows that young people are drinking less than ever since we've been recording data on this in Australia. And while at the same time, middle-aged and older Australians are drinking at record levels. So maybe firstly, why are young people drinking less, in your opinion?
Yeah, I found that was a really good part of this documentary, that it didn't just focus on young people, focused across the life course, because there tends to be this stereotype in the community that it's only young people who are drinking in harmful ways. But when we look at the statistics, the people that are currently in their teens and 20s are less likely to drink compared to people the same age from the 90s and the 80s and the 70s. I have some colleagues at La Trobe University, Michael Livingston and Amy Penne, and they're leading a research project at the moment exploring why it is that young people drink less. They don't have sort of one magic answer to that. There's a number of reasons that they're exploring, and I'll just go through some of them. Some were mentioned in the documentary as well, but they're looking at how young people today tend to be more risk averse, so more worried about the future, more worried about the world, and also living in the parental home longer under more surveillance. So these things can lead to reduced drinking. People are socialising in different ways. Leisure time is different. The sort of typical working week and ending with a weekend is not necessarily as widespread as it once was. So that changes how we socialise as well. They're more worried and they're more aware of the health effects than they were decades ago, which I guess is a positive thing. And also, as mentioned on the source, the way that social media is embedded in the worlds of young people in these spaces where drinking occurs has an effect, because people are more concerned about their image and ensuring they're in control of themselves in public spheres, where that videos of them doing the wrong thing could stay there forever. And I think many of us, certainly my age, would think, well, if there were videos of what I did at that age, I wouldn't be so happy about that if they were online now. But that wasn't a thing for me in the late 90s, early 2000s. And I guess the final thing that they're looking at is that it just seems to not be quite as cool as it once was. Doesn't have quite as much cultural, and perhaps also because there's more diverse cultures, subcultures and mini subcultures that you can access now if you're a young person growing up. And we saw an example of that in the final episode with the straight edge community that has been around for a long time, but being able to access those communities and identify with them, and they may have different ideas about whether alcohol is a positive thing to do.
Flip, was there something you wanted to add to that?
No, I was just thinking, I found it really interesting that when I like going out dancing. I've always liked going to nightclubs, and used to do it drinking. And I was quite surprised to find there's quite a huge subculture of this kind of wellness culture of people who still go out dancing and still go out clubbing, but it's done with completely dry bars. So they'll have like sacred cacao cocktails, and it's all completely alcohol free, and your body is a temple kind of thing. And you wake up early in the morning and go and do some yoga. And I found that really interesting because all of the other aspects of socializing are still there, the dancing, the community, the dressing up and going out, but just not the hangover in the morning. And there's definitely, I've noticed in the last couple of years, a real kind of upsurge in that kind of thing. And the other thing that's kind of interesting, I think we're of the same vintage, Monica, but back in the day, if you didn't drink, you were kind of a bit uncool. And I feel like that's changed now. I think when people, if you're a bit younger and you say, I don't drink, it's pretty normal, and people don't give you as much of a hard time. Whereas when I was a teenager, it was kind of all about going to parties and getting drunk. And if you didn't do that, you were a bit of a social outlier. So it's been interesting to watch that change over time. And I think, find your tribe, and then it gets a lot easier, basically.
So the next question I've got is actually for Julie. So I'm hoping our producer is able to bring Julie onto the panel. So I guess the conversation we're having is that, there's this narrative that young people getting intoxicated are the problem, and the perpetuation of this narrative by the media prevents us from having some conversations. And some of these conversations are difficult conversations and perhaps more important conversations. For example, it's the regular use of alcohol, not episodes of intoxication, that contribute most significantly to the burden of disease in Australia, particularly among older people. Though unlike the harms associated with intoxication, these sorts of harms and the drinking patterns associated with them are less visible. So Julie, what are the implications of the media not covering these sorts of harms?
Yeah, look, maybe just to backtrack a little bit, I think the media's focus on alcohol-related harm amongst young people is probably largely because young people's drinking is very much in your face. The sorts of images that were featured in the second episode of young people falling over in the street, throwing up, and the sort of things that you typically see, after Melbourne Cup, you'll see young women particularly looking very messy and staggering. That's easy for cameras to capture, for people to take a pic on their phone and then upload it to social media, and then it gets circulated through the media more broadly. So it's out there and we can see it, whereas older people's drinking almost overwhelmingly occurs in the private sphere. It occurs in people's homes or their friends' homes, or as we saw in episode 2 with the older women in the lifestyle village in Queensland, in clubhouses within retirement villages. So it's not visible. It's not out there. There's nobody taking pics and uploading them to social media. And so because of that, it tends to go under the radar, as does the harm that occurs, that is associated with older people's drinking. To come to your question, the implication is that when those images disproportionately focus on younger people in the media, what that lets older people do is really it's easier to cognitively disassociate themselves from any personal risks that their drinking might bring to them. And that kind of brings up an interesting thing, is that all population groups, whether they're young or old, tend to compare their drinking to other population groups. Most usually it's older population groups comparing with younger population groups. And in the research that we've done with older people, that happens all the time. When they talk about problematic drinking, they're talking about younger people. They refer to the type of images that we saw in episode 2, and those images of young people looking a bit messy and throwing up and what have you. For them, that's what they view as problematic, and they say, well, that's not how I drink. We don't drink like that. Therefore, our drinking, so the implication is our drinking isn't problematic. We drink moderately or low risk. And that's the terms that they use, because they are contrasting it with those really visible images of what they view as problematic drinking. And that so also means that they can more easily brush off the harms that might come from their drinking, particularly for the women that were featured in episode 2, those older women at the retirement village. I mean, they were drinking at risk levels. And among the women that we interviewed in our research, the Australian women, 30% were drinking every day, and there was a significant proportion who were drinking at risk levels. So it wasn't just sort of 1 or 2 glasses a day. So to kind of come back to your question about when the media don't portray older people's drinking in a way that really accurately and authentically reflects where they drink and how they drink, then it reinforces their tendency to downplay the risks associated with their drinking. And it undermines public health efforts to try and raise older people's awareness of the risks of alcohol. And I think it was Monica that you mentioned before that, there is no level of alcohol that is safe. And it also undermines public health efforts to increase that sense of personal susceptibility, which is often a key element of behaviour change campaigns, public health campaigns that try to minimise the risk. So it does have significant implications.
Can I just raise one other point as well? I have wondered a little bit, because you've got, boomer parents who they grew up in the sort of the hard drinking 80s and 90s. They cemented their drinking behaviours, and now those have carried on in the home, and they've had kids who are now in their 20s and 30s. And I have wondered, and I haven't seen much evidence of this, but I have wondered about whether those kids have grown up seeing their parents drink to unsafe levels behind closed doors, perhaps to their detriment, and they've grown up thinking, I don't really want to be like that. And maybe there's been issues that have been raised. I think that would be a really interesting conversation to have, because it kind of is interesting that there is that, as well as all the other things that Monica mentioned. There is such this generational shift that's happening, and often you'll find that people of one generation will reject the behaviours of the one that came before it. And so there is potentially something in that people are just saying, I don't want to be as unhealthy as my mum and dad when I get to that age, and I don't like what they do to themselves every night, how they drink, a bottle and a half or 2 bottles of wine before they go to bed every night. And there's certainly a lot of that going on around the country at the moment.
Yeah, there was some evidence in our research that some of the women, their adult children, were telling them that they were drinking too much.
Yeah. Interesting.
You can't find your keys. You keep forgetting things, Mum. It's because you're drinking.
Right. Yeah.
They wouldn't accept that.
It's almost it's almost the younger people rebelling against rebelling. In fact, that were the explicit words that Shaun used to talk about a group of young people that had chosen to cease drinking. So I guess I'd like to close by if we could bring everybody together, because essentially there was this marketing campaign in the final episode that we can't show due to the issues with streaming over YouTube that we've just realised. But that was kind of trying to find a way to change this narrative that we've got with alcohol. So I was hoping to ask each panelist as what you think we could do to change the narrative of alcohol and other drug use in Australian society, and what roles the media might play. Maybe you could start, Julie.
Yeah, so look, I think documentaries like On the Source are a really good start, a really good way, particularly to get the issue of alcohol use among older adults onto the agenda. And at the moment, I don't think it's there. So in particular, the sort of images that we saw in episode 2 of those older women drinking, and drinking quite heavily, are a little bit confronting, I think, and they're not the sort of images that we normally see. They don't really fit those ageist stereotypes around older people, particularly in retirement villages where you might get images of, well, they play bowls and they go to knitting club and they drink cups of tea. And clearly the women that were featured in the documentary were not doing that. They were living a very different sort of life as they get older. But what I think is really important is that those scenes really highlight the social nature of alcohol use. They were very socially engaged and have a really enjoyable life. And that's really important for older people, is to be socially engaged. But those images are also really authentic, and I think they will resonate with a significant proportion of older people, older Australians. I think the other thing is that because it really highlights, because it's such a social activity, in that context, health priorities come down. They're not a concern for these people. So I think the documentaries like this really provide a good springboard to have those conversations with older people, particularly, and that's the area that I'm interested in, about their relationship with alcohol and about how much they drink and how frequently they drink.
So it seems like what sort of your take-home message is that the messaging to change the narrative needs to be very targeted towards different demographics, and it needs to be authentic. Yes. Flip or Monica, are you okay to provide your closing thoughts?
Yeah, I mean, I would like to see more focus on the positives of giving up as opposed to the negatives of, what you're missing out on. I think that surprised me so much. So to give you some context, I only ever intended to stop drinking for 1 year. And I got to the end and I sat down and I thought about it. And I thought, I've gained so much over this past year that I don't think I want to do that again. And, the stuff that I hadn't really associated with alcohol, things like energy, sleep quality, I lost weight, I have more energy to exercise, I had better focus, all of these things that sort of the slow creep over time, I felt like in total I gained more than I'd lost. And there's a lot of focus on, even giving up alcohol in Australia, this sense of loss, this sense of, if you don't do it, you're going to become a social pariah. How can you go to weddings? What will you do when you go networking? So I set out to challenge all of those things, and I did every single one of the things that I did before, and I did them completely sober, and I survived. And I didn't only just survive, I had a really good time doing it, and I felt much better the next day. You never, or you very rarely see that as a message. It's kind of all about alcohol-related harms and how you're going to end up in dire straits if you do this. And I think one of the problems is that people, a bit like those images that we see of, people languishing in hospital beds and being forced to throw up because they've had a big night out. There's lots of people who will think, oh, well, I drink a bit, but I'm not that bad. I won't end up in that situation. And they tend to not see themselves in the extremes. So the messages about things like you will get cancer just don't resonate with them, because they're like, oh, that's just something that happens to other people. So if there could be, I think it'd be interesting to try a campaign that says something like, well, this is what you'll actually, if you don't drink, then you actually gain all this stuff. So yeah, who knows?
Yeah,
I mean, because I think the current messages aren't really working for people for all those reasons, and I do think that there needs to be a concerted effort to get messages across. You're going to have to prize alcohol out of people's cold, dead hands at the moment, is the vibe that I'm getting. You know, people are like, I'm in the middle of a pandemic, don't take away my crutch. And I think we're going to have to do a lot of work to explain to people. Like, one thing I would say to people right now is, do you know that if you drink your way through the pandemic, the likelihood is that your anxiety and mental health problems are going to get worse potentially. But yeah, I don't think people make that association at this point.
So I think you know, following on from what Julie was saying, in addition to the narrative change, you know, the targeting of the messaging needing to be to particular cohorts in order to change the narrative, there needs to be a shift away from focusing on the harms associated with drinking to the benefits that you get from not drinking. And as somebody who's lived in both Western Australia and Victoria, I noticed in Western Australia the tobacco campaign here when I left to move to Victoria was that every cigarette you do is doing you damage. And when I moved to Victoria, the message was every cigarette you don't have is doing you good. And that, as a former smoker or a smoker at the time, that message actually resonated better with me than the message that I should, you know, that it's doing me harm. I think you raise a good point. Monica, is there anything? What's your sort of take-home message for tonight?
Yeah, well, I mean, I agree as well with what you're saying around positive messaging and trying that for something different. I don't think the public in Australia have really thought through what might be positive about not drinking. My research is more focused on illegal drugs, and so in watching this documentary exploring the role of alcohol in Australian life, I was struck by how difficult it would be to do the same documentary on any other drug. Any of the less socially acceptable drugs in the same kind of depth. But if that were possible, if we were able to explore openly with different members of society how they use cannabis or MDMA or methamphetamine or heroin, and not in the way that we do in the documentaries that do exist. They tend to be, here's this person, you know, they've hit rock bottom, they've recovered, and there's particular tropes that are used, but you know, how particular psychoactive substances are embedded in people's social lives, how they are approached, how the downsides are managed. I think it could open up some public discussions about drugs and present multiple contrasting narratives. The problem, of course, is prohibition and the threat of criminal sanctions, making it more difficult to make a documentary like On the Source about other drugs. And, you know, I noticed obviously in On the Source they had blurred out faces of people, you know, I guess they hadn't necessarily got their consent and they were in compromising situations. But, you know, on the other side, they were able to talk to people who were completely open about their very heavy drinking and were able to do so. I think both alcohol and other psychoactive drugs, you know, journalists and others producing this content can make a difference by presenting multiple perspectives and stories, not just the accepted ones, the stereotypical ones, the ones that make us not so comfortable. And the more of those alternative stories that come out, I think, you know, the more the public and politicians might be open to alternative policies and strategies to manage both alcohol and other drugs. It's probably not that simple, but it could go some way to opening up the discussion, I guess, is what I was
Absolutely.
thinking.
That Kate, if I could bring you in maybe to then comment on sort of what Monica's talking about in terms of, you know, encouraging the media to look at these different narratives and how that might change the broader narrative with regard to not only alcohol but other drugs as well.
Yeah, absolutely. The media is a little resistant to being told what to do. I think it very much has to be a sort of carrot, not a stick, when it comes to changing media behaviour. Some newsrooms there's a lot of people trying to tell newsrooms what to do, and some of them have had huge success. I mean, the movement that was trying to influence the way newsrooms handled suicide and self-harm, they've done a really good job. There's also a movement about how we report violence against women, and that campaign group seeking to change newsroom behaviour has also had some good impact. So if you're looking to change editorial decisions, then there are ways to do it. There can be education campaigns. We have a lot of people approaching us as journalism educators to start talking differently about this, start raising the awareness of the young journalists who are going out into the industry. And we certainly do that. But when it comes, the other field is Julie's field of sort of health promotion and awareness of what health promotion can and can't achieve. And I think that ties in beautifully with what Flip was just saying, that, it's well known in the health promotion field that talking about positives works better than talking about negatives, that you're more likely to make people want to, eat well by saying, be healthy, be happy, than you are by saying, don't be miserable and sick. We know this, and yet it's not maybe that this is just those people who are doing a bit of this with alcohol need to do more of it. I think that there's scope to look very much at how different platforms do this. The Instagram as a platform, Twitter as a platform, there's scope here for sort of celebrities, celebrity buy-in, to be posting things like feeling fantastic at 5 a.m. yoga, so glad I didn't drink last night. That kind of celebrity messaging might start to be, but this is not editorial making. If you want editorial decision making to change, then following the example of some of the people who do health promotion really well, who are like, hey, you're a newsroom, can I supply you with interesting people to tell human interest stories, with stories of, here's some statistics that demonstrate impact. Because it's well known what editors are looking for. Editors are looking for impact, proximity, conflict, if possible, heaps of human interest, scale of the problem, and you tell the story using those elements, and that's how you attract an editor's attention. They're in a hurry, they're understaffed, make it easy, that kind of approach. And as I said, it's not rocket science. It's something that the Heart Foundation knows well. It's something the Kidney Foundation knows well. And events like Dry July, that's a really good one, that you pick a month, and that's the month that you focus on telling those stories in, and because it gives it a timeliness for the media to be able to attach onto. So I just think those people who are doing those things are doing well. They should do more of it. I think that Julie and Flip and Monica have raised some excellent points.
So in summary then, to sort of pull it all together, it sounds like the media can potentially be part of the solution in terms of changing the narrative, not only about alcohol, but also other drugs. And in the same way that Julie talked about the need to focus on different cohorts, the way we talk to journalists, we need to target the information in that particular cohort. And as Flip was saying, in doing so, you need to work with the carrot, not the stick. Whether it's giving people information about the benefits of not drinking versus the harms of drinking, or demonstrating the benefits of this particular story, and demonstrating to editors why this particular story is going to be more newsworthy, rather than trying to beat them with a stick to focus on, it is going to eventually change the narrative. So I'd like to bring the webinar to a close. But before doing so, I just want to double check with our producer that we are no longer an interactive webinar, unfortunately. And unless I hear otherwise, I'll just continue. So. Clearly.
Yes, but otherwise, we are, we do have some comments. There's not a whole lot, just some people commenting on their own experiences.
Fantastic. Well, at least people were able to interact. Look, I would firstly like to thank our panelists, Flip, Julie, Monica, and Kate.
Thank you.
I would like to thank everybody for participating, even if and for those that were able to come into part 2, especially, and navigate the internet to be able to find us for part 2. But I'd especially like to thank Nick Wallace, who you just heard from then, who's been behind the scenes as our producer tonight. Without Nick's work, this would have looked like just another Zoom session that I'm sure everybody watching has become fatigued with in the past few months. And unfortunately, that's how we had to finish, because we weren't able to continue playing the clips. Finally, if you haven't checked out AOD Media Watch's website, then please do so. In addition to the resources that I mentioned at the start, we provide ongoing critique of the media in a similar fashion to ABC's Media Watch, although our focus is, of course, a little narrower. If you see some poor reporting on AOD-related issues, get in touch with us. Our aim is not to name and shame journalists, but to work with journalists to increase the accuracy of reporting about drugs and decrease stigma so people feel more comfortable about talking about drugs and their issues, and potentially even seek out treatment if that's appropriate. As we've seen tonight, one way in which we can do that might be through changing the media's narrative when it comes to alcohol, and some other resources that are worth checking out in this space is Mind Frames. We've done a fantastic job of changing the culture in journalism when it comes to mental health, and are now trying to tackle alcohol and other drug use as a sort of replicate what they've done in that space with mental health. There's also the Constructive Institute, which aims to increase good investigative journalism and reduce the sort of salacious reporting that we've come so accustomed to in the tabloids. And there was the Junction, which Kate talked about as another resource that journalists and people that are interested in this media, journalism, public health, and alcohol and other drugs in particular might find useful. Thanks very much.
Are we done?